partnering with us. A couple of weeks or a month ago, one of my staff members said, you know, I really miss the networking opportunities and finding out what's going on with the rest of the programs. And I thought, well, let's do some Zoom sessions and we can get everybody online to share. So we had around 85 people in the first one for youth, and I thought it would be great to do an adult and seniors one as well. So we've got Michelle here. She's our adult coordinator here in this side of our county, and then we've also got two other people on the line from View FCSS that are in Grand Cache. So we will just start with the different programs and services that we're offering, and then invite you to share yours as well, and hopefully we can all learn from each other. So thank you very much.
Thank you, Lisa. So my name is Michelle Hagan. I haven't met too many of the names that have popped up on the chat. I would like to start with just welcoming everybody. This is an interesting way to share everybody's programs, and a great way being that it's minus 35 throughout most of the province, so nobody had to travel too far. So I'm going to start with the programs that we're running here in Valley View. And because we are ramping up for tax season, we'll start with our CVIP program. We've been hosting the tax program for a number of years, and it just keeps growing year after year. We offer it year-round with our staff members doing year-round taxes, but come tax season, we use volunteers as well. So March and April, we have the volunteers coming in and doing taxes for people. Last year, with the COVID shutdowns, we switched to a drop-off program, which worked very well, and we will be doing that again this year and possibly into the future because it does seem to work. Our main goal for the tax program is to ensure that everybody's getting their benefits that they're entitled to. Yes, thanks, Lisa. So that's our main goal. It seems to be working well. Last year, almost $3 million came back into the community with benefits and returns to them.
I'd just like to say, you know, that number is a big number. And if I love to use that number because if you can tell your politicians, your councillors that, you know, that one program alone brought in over $3 million back into the community, well, hallelujah, because that is more money than this entire FCSS program costs. So it's a home run, that program in and of itself.
We also, with that program, do outcomes measures on our volunteers by utilizing some volunteer questions. So that is a program we can report on. Our other big program, of course, is home support. We have 100 clients throughout the entire MD, but yes, 70 here in the Valley View area. We do basic housekeeping, limited respite, some meal prep, and normally we also do some transportation to essential needs. That's been pulled off on with COVID. We're not doing any transportation. The main outcome that we're looking for the home support program is keeping people into their homes for as long as possible. But we have a secondary outcome as well, and that's to keep their clients informed and let them know where they can reach resources, who they can reach out to. So our workers that are going out into the homes have dual job positions as far as they are doing the basic housekeeping and other skills, but they're also sharing their knowledge and letting them know where they can access resources. Hand in hand with the home support program, we have a program called Wheels for Meals. That is a partnership with our lodge, and the home support ladies transport the meals to people that are purchasing them from the lodge. That unfortunately is on hold right now because our lodge couldn't keep up with the demand with all the new COVID protocols. But hopefully we can get that up and running again shortly.
Before we move on to the next program, we're just going to talk about the first question I see is explaining the drop-off process for the volunteer income tax forms.
So what we've been doing for the drop-offs is we have a drop box. Last year we had to utilize a couple other, like the town office and our MD office, who had drop boxes, and the people would pick up the forms from us, which we had in a box outside of our door. There was nothing important in them, just forms. They picked up the forms, filled them out, and then dropped them into a secure drop box. Those forms were included the authorizations to sign. When we received those forms, they sat for 5 days before we processed them. And when we processed them, we e-filed them as long as the proper signatures were there. And then the copies were mailed back to the clients.
That's an excellent question. And I know a lot of FCSS programs have adapted in basically what Michelle has just talked about. But if that explained it and answered your question, awesome. If not, if you have more questions, then that's great. And I see Cindy has just said that the CVIT program also has guidelines on how to run a drop-off clinic. So that's awesome. Just quickly then, does our home support assistance program do respite? So respite is an interesting word. It really depends on how you want to define respite. We do not do overnight respite. Our guideline is assisting folks 4 hours a week. However, if there's other circumstances that a client needs more assistance, we can kind of massage that number to make it work for everybody. But we don't, you know, it's going to be a maximum of 4 hours really of that. If it's respite instead of cleaning, we will do that. But no overnight and no longer than 4 hours at one shot, basically.
Just to add to that, because the girls are not personal care aides, we also don't do anything that needs personal care. So we can help somebody walk to the toilet, but we don't help them toilet.
Right.
So we're limited there as well.
Yeah. And then just finally there, I see, how does transportation portion qualify under FCSS? Well, guess what? It doesn't, right? It doesn't. But we're only doing essential needs, and we are in a rural and remote area. And here's the final great thing is that our council contributes way more than the minimum contribution. So we're able to use our other municipally funded dollars to help with those transportation expenses. They are not FCSS dollars.
I think we've got all the questions that were up, so I'll keep going. Another program that we have that is so loved and so missed right at this point is our Balance program. Balance is a restorative yoga program. So it's not recreational. It's set up for fall prevention and for helping people recover after a surgery, a knee surgery, hip surgery, those types of things, or an injury, or a few people that have had illnesses such as MS or other neurological. We've had great luck. So it's very individualized, very personalized, smaller groups. We were doing no more than 20 in a room. We're hoping to get this up and running again with much smaller groups. We have people calling on a regular basis, just waiting for that to open up again. So much loved program there. We also offer workshops, a lot of different workshops, but I'm just going to talk about a couple of our real popular ones. Probably the most popular workshop is the Just in Case workshop, which is one of our programs. The Just in Case program is about planning for the future. So, but it's not just an estate or pre-advanced planning program. It's about all kinds of emergencies. So what we find is a lot of people, somebody will end up in the hospital or pass away, and that's the person who paid all the bills, stuff, and the other person's left. The other person's left really lost. So the participants get to make up a binder, and in that binder, they will also talk about the bills, the insurances, all the stuff that runs their household, so that when somebody or the kids have to pop in and start helping out with mom or dad, they have a guideline. So we do talk about wills and power of attorneys and stuff, but it's more than just advanced planning. So that one is always well attended.
Like, I mean, when Michelle says well attended, like we could offer, because our county is large, we could offer probably, if it wasn't COVID, we could probably offer four or five just in case workshops a year, and they would be anywhere from 8 to 15 people in them. So it's very popular.
I'm just going to pop back because I see there was a couple of questions regarding Balance, the yoga program. So yes, we do have a trained instructor who actually had taken over and above and specialized training in dealing with seniors. We've lost that instructor, but our new instructor is almost as highly trained and willing to take on extra training as well. So it is a subcontract.
Yeah. We hire somebody out to do it, and we do not charge the participants for coming. And depending on how things go, sometimes it can be once a week, sometimes it can be twice a week. And typically, because of the overwhelming success and popularity, we've done it in the spring and the fall. And we have considered it online. However, the instructor feels that it would not be as effective online, just because she can't do the individual one-on-one support that may be needed, and she can't see the whole number of participants. So not a great option online, unfortunately. I would love it to be, because people are really missing it. And hey, Fay, so we are from Greenview FCSS. So Greenview FCSS starts just outside of Fox Creek, all the way. I know people keep on saying Valley View, but we are way more than Valley View. Our office is located in Valley View, but we have a lot of clients in DeVolt, Grovedale, and then of course our Grand Cache chain as well. So it's the empty of Greenview where we're from.
I think that covers the questions for ballots. Somebody asked about just in case I present that or other team members that have attended, it's not
there's not really like a specific training involved in that. It's taking a look at the content, making sure that you're familiar with the content, and then just running over the content. And Michelle and Diana in Grand Cache and Sonia, they're all great presenters. So they just, part of our jobs is facilitating. So they just facilitate the group.
And yes, I don't mind sharing the template. If you give me an email.
What we usually do is actually just send Melissa an email.
Okay.
And then we'll just send Melissa the information, and then she can distribute it. If that's still okay, Melissa, to do that with this group.
That's perfect. Thank you.
The other fairly well attended workshops have been the caregiver workshops. So we started out with Compass for the Caregiver, which is a huge course, which takes 7 weeks. So we didn't have any luck with trying to trap people in for 7 full weeks. So we broke that down into individual workshops that were just one-offs. And Alberta Caregivers has those workshops. So I took the training for Compass for the Caregiver. And so Caregivers Alberta gave me their individual workshops as well. And there is a lot of them, but the most popular ones that we've been running is, grief, caregiver grief, and stress management. Those are the two that tend to be requested the most often. I have not run them online at this time, but I know Caregivers Alberta does. And but I do facilitate the same material in a one-on-one with a lot of clients. Either they come into the office and they often come in for other things, but we facilitate the material. I send them home with information, or I can go into their homes and do this in their home if they can't leave. Timing for them that they can get away from their people that they're caregiving is often hard. So we try to facilitate around them. See, Older Adult Day. Older Adult Day is another one we've been running for about 7 years. It's a day of learning and workshops, set up almost like a little conference. It has changed a lot over the years. We are aiming at touching base, not just with the seniors, but a lot of times their older children that might be assisting them. So we get a lot of people that come for their parents because they want the information for their parents. We also have a lot of people that come with their parents, which is really nice to see. We have a variety of topics. In the last couple of years, we partnered with our multiplex. And so we turned it into a real conference where people could choose to go to different types of sessions or workshops. And some of them, they got to actually try out physical activity items at the multiplex, as well as things like speakers from Alberta Health Services, Seniors Outreach, Wise Owls. We've had legal professionals, financial institutions, Alberta Seniors, Service Canada, pharmacies, and senior housing facilities. They've all come in and they've talked about a wide variety of things. Pensions and benefits, frauds and scams, COPD, stress management, diabetes, lifeline, cannabis, emergency planning, estate planning, fall prevention, mental health, and even more. Like I can't even list them all. But every year we try to get a feel for the community, see what people are looking for, and we try to bring in speakers that will fill those holes and get people interested and connected. So we are planning this again for October in the hopes that life will continue and we can get back at it. And if not, I guess we will maybe be looking at trying to do something online. But the hopes is to be able to do this in person. Any questions on that stuff? No, we're good, Kate. I am going to turn it over to Lisa because we have an exciting new program that we're going to try rolling out, and I'm going to let her talk about that one.
Okay, sure. So before I start on that, and I don't want to take up very much time here because I'm really interested in what you guys have to share, but just a couple of other things that, so you know, we're really focusing on the older adult today, but having said that, we also partner with the Alberta institution, Say Jess, to do the Finding Our Voices and the self-esteem, which is a self-esteem program for women, as well as Growth Circle. So that is for women who want to leave or have left an abusive situation. We do have older adults come to that sometimes, and our area got very high domestic violence rates. So we need to have some prevention and some support for folks who are living with that. The other thing that Michelle didn't mention that's really wonderful in terms of, you know, if we're on the same line as poverty reduction, like the CVITP, is the Commissioner of Oaths. So I have 2 staff on board, and soon to be more, with the ability to commission items for free. And again, all these things, they just bring people in, they can see how welcoming and the plethora of services that we can offer. And the vast majority are no charge. So yeah, we're going to try this pilot project. Everybody, you know, is aware, particularly in COVID, but even before COVID, about the social isolation and what we can do about social isolation. So we're just going to start a pilot project. I hope that we can all talk again next year and you go, hey, how'd that pilot project go? And I could give you some good news. So basically, we've decided to call it Tech to Go. And essentially, we know that a lot of our seniors are isolated, a lot of them are living in poverty, and a lot of them are in rural areas, so they don't have internet connection, nor do they have the Wi-Fi, they don't have the iPod or iPad itself, and they don't know how to use it. So there's quite a few barriers there. So to kind of bash those barriers down, the idea is to utilize our home support workers and set up our home support workers with cellular enabled iPads. So the idea is that the home support worker will go in to the client's home, ask them who they'd like to connect with. It could be their family in Ontario, or their family down the street that they haven't really seen. It could be, you know, their grandkids, granddogs, whatever it is, or simply the person that they used to go to coffee with every week, and they can't now because they can't leave their home. So the idea is that with the cellular enabled iPads, the home support worker, which course we will buy, they will be ours. We'll talk to, I've spoken with our tech team to decide which ones we're going to purchase, and the ladies will go in, set the person up on, of course they'll be trained, but they'll set the person up on the iPad, you know, do all the connection piece, and then go and clean the house while this person can have some interface with whoever they choose. And then at the end of the 2-hour session or 3-hour session or whatever it is, our home support people disinfect that, take that to the next client. And we're going to start with probably just 3, and as you know, the trial kind of unfolds, and hopefully we'll at one day soon, i.e. this time 2022, every single home support worker will have one of these if their clients are interested. So looks like no questions. Okay, all right.
It looks like that we're not the first ones to do
Right.
that, which is great.
Yeah. So Hope and Rebecca, how's that working? How's that working for you guys right now?
Hi, I have almost 100 devices out in the community, and what we classify as community is MD of Greenview, Saddle Hills, Grand Prairie, County of Grand Prairie. So we cover a pretty large area. It has been, we had the iPad program going back in 2018. And then when COVID hit, we just amped it up. It is quite intensive. It's intense. We went to the iPads more so than the other devices, because if you have multiple devices, you have to train people to understand multiple devices. So the iPads seem to be the most user-friendly for not just the seniors, because the assumption was the staff, the younger staff would take to this quite easily. We find that that was an assumption. We have to train the staff just as much as we do the seniors. And often the seniors are almost easier because they don't have the same previous experience. So they come to it with fresh eyes and usually go pretty quickly with it. We do loan out in quite a large area. I provided my phone number if there's somebody that is interested. But all our iPads are preloaded with information. And I would suggest if you're taking this on, you preload them and have them all the same. So if you have to help somebody, you have the same thing on your device as they do, so you can walk them through it.
Right. All right. And what are the outcomes?
It's been amazing. Absolutely amazing. A big part that in the beginning was the families going, oh, mom won't use that, or dad's never had this. And then they come back to me and go, wow. So we have the iPad set up so they can, if they want to order, like the ones that are at home and isolated, they can order their groceries online. We have connection to other agencies for mental health. We have connection to, of course, to the Grand Prairie Palliative Care Society. We connect them with volunteers if they don't have connections of their own. And we also connect them with volunteers to help them learn how to use their device quicker and better.
Okay. Awesome. Thank you very, very much for sharing that. And yeah, I'm totally pumped about that. So it's great to know that the outcomes are good.
It's amazing, the outcomes. If you need any help getting this up and going, you can definitely reach out to me and I can help you with what I've learned, because it's been a learning process for me.
Okay. Thank you. Thank you very much.
There's a question about who pays for the data.
Okay, so the data where the MD will pay for the data. We're not asking for donations or anything like that. We're gonna cover it all. right, so Michelle, did you have anything more you'd wanna?
No, but somebody did
Somebody-
ask about.
Oh, yeah, so,
finding voices.
yeah, finding our voices in growth circles. So those are all about really prevention of domestic violence and support. So we partner with a or backbone organization called SAGESS. That's SAGESSE, and they provide free training. And not only do they provide free training to facilitators, community staff or volunteers, but they also provide snacks and transportation, funds for transportation. So if somebody can't get here, they'll pay for it. They also provide some funds for babysitting. So you can't really beat that partnership. They have been evolving over the years, and but they're the people that we partner with to provide this, and it's about a six-week course, and it's all about group sharing. We are going to have one. Actually, this month we're starting one. There's going to be two. One is going to be for people right in Valley View that can come for an in-person session, and then we're also going to offer one virtually, different date, different time, so that there's going to be ample opportunity for and choices for people to participate. Yeah. All right. Okay, so maybe what we can do now, just to complete the Greenview FCSS stuff, if you guys don't mind, we'll just hop over the mountains quickly and go to the Grand Cache location. We've got Diana and Sonia on the line. Do you want to fill in what else Michelle and I haven't covered?
Sure, we can go ahead with that. We'll start with Sonia first, talking about her program, and then I'll follow up afterwards.
I'm Sonia Clark. I am the outreach coordinator for Greenview FCSS in the Grand Cache area. Mine is a new position, but I do things like provide transportation, but during COVID times, I do deliveries for essential needs like medications and groceries. I provide an Indigenous teaching at Whispering Pines Lodge to increase the cultural comfort over there for the Indigenous. I provide home visitation for those dealing with isolation and loneliness. So I am still able to do in-home visits right now, but a lot of my clients are preferring to do over the phone visits, or we message with some back and forth. I help notify with seniors of new benefits or help them with benefits, as everything is kind of online and we know how that goes for the seniors and everything. I also am a liaison for my clients with their families that may have moved out of town or with other services in the community that they may need. I provide advocacy. Sorry, I'm not very good at saying that word. Yes. And I think that's sort of it. We started my program, my position, because the older Indigenous population were not comfortable with entering the Whispering Pines Lodge. So I believe it helps a lot that I do a cultural event there once a month. So that makes it a little easier as well. making it culturally inclusive. And I think that's about it for me.
Thank you, Sonia. Sonia's program is more than that. She writes letters to a lot of seniors, people that are dealing with mental handicaps. She also, with the Indigenous population, we have what's called enterprises and cooperatives. None of our Aboriginal population that are in our area are status. So there's a lot of education and understanding that she does, which really helps. I know for the population at Whispering Pines Lodge, many of the Aboriginals did not feel comfortable going in there, and she's kind of bridged that gap right now. So we had individuals that left the lodge because they felt that their cultural needs weren't being met. And since Sonia has been involved in this program, we now have, probably about 5 or 6 that are in the lodge that are Aboriginal descent, which is really good. And I know from experience, my mother-in-law's in there as well, that we're finding that the Caucasian population is partaking of her Aboriginal events nights or afternoons, and they just love it because it's now expanding their worldview on the Aboriginal population that we have in Grand Cache. So it's much appreciated, and we really enjoy the feedback that she gets. She also writes letters to our senior populations and those that are living with mental or physical handicaps. And so they get to participate in her life as she goes on vacations. She sends pictures of her vacations to them. So they feel that they're actually being part of Sonia's family, which is a really nice sort of personal touch that she does with the clients and individuals that we have in our community. I have to say that we had the training from Michelle and Just In Case, and our community just loves the program. We could probably offer one every 2 months because our seniors population really loves it, and now they're expanding it where we will probably go to the general public and offer that program as well, because they want their families to be understanding and proactive, so that if anything happens, that at least the information's there for their families. We also have the Meadows to Mountains homelessness prevention project, which is really important. We found that we have probably about an equal number of senior adults as well as families that participate in that funding, which shows that times are hard for everybody right now. Our home support staff here will assist clients, but they also do the referral program, as Michelle mentioned. They also check to make sure that they're getting enough groceries in their own home at the same time, and doing a lot of that impersonal, that personalized communication, so our individuals don't feel so lonely right now. And we're finding some of our seniors have not left their home since May. And so the only source of communications, physical and in person, is with our own home support group, which is so important to make sure that everybody at least has a chance to have some healthy interaction during these times. So we enjoy our little mountains, but we love the meadows too, where our mother part of our Greenview FCSS is in Valley View, and we appreciate all the knowledge that is shared by everybody. And please take this opportunity to let us know if there's anything we could do to assist you or share an information that you can give us. Thank you. And I'll give it back to Lisa.
Okay, thanks everybody. Okay, so what we did last time that worked well is if you just want to put on the chat box who you are, where you're from, and that you're ready to share, and we can try and get through as many people as possible, because we know what we're doing, but now we want to know what you guys are doing. And Lisa.
Good morning, everyone. I'm Lisa from Vegreville. Yeah, I'm ready to share with you perhaps some of you might be familiar with the Senior Center Without Walls. This is a program run through the Edmonton South Side PCN, the Primary Care Network. I have copied their model. They gave me a wonderful handbook on how to get this started. I'm calling it in Vegreville the Seniors Link In Calls. So we're using Zoom technology, but it's Zoom audio primarily. I have a couple of seniors who do connect with us on Zoom video, but most of them are Zoom audio. We pay about $125 a month to Zoom to have a phone-in capacity for our seniors. So many of them are not able to dial in the 10-digit toll-free number and then the 10-digit meeting ID number. So FCSS staff will phone them in. All I have to do is to train the seniors that when they see on their call display that it says New York, New York, I always tell them, it's not Broadway calling you, it's me. So we're able to offer 2 or 3 sessions per week. We have done educational sessions, you know, with the, for example, the dietitian or with the personal directives, all kinds of educational topics that the seniors have requested. But we're doing 2 sessions a month on chair exercises. Our PCN exercise specialist is leading that. We have the mental health capacity building project in Vegreville. It's leading 2 sessions per month on mindfulness and fighting depression, coping skills, and so on. I lead 2 sing-alongs per month on Zoom, and my seniors just love that. And we do a couple of sessions per month, Tickle Your Funny Bone, just jokes and funny stories. We are looking at all kinds of ideas for March and April of different information sessions that we can offer. The seniors tell me that this anchors their week. They're very, very happy to have something to look forward to, even if it sounds to us like a simple phone call. For them, it's a group phone call. We're getting 12 to 20 people per session. And in a small town like Vegreville, we're really, really pleased with those numbers. And the program is growing. So yeah, that's what we're doing. Also gearing up for the modified drop-off program for CVITP and hoping that goes well. We tried some doing some taxes on the phone last spring, and for the most part that went well. Yeah, that's that's what's going on in Vegreville.
Hope, did you want to share?
Well, I ranted on about our iPad program. It is really busy, but we also have a virtual pen pal program that's going. We have 40 facilities involved in the program, and we also have community members pretty much all over Northwest Alberta involved in the program. All the letters are either emailed into us or pictures of them are sent to us. They're screened and then they are sent out in one format daily, Monday to Friday, to everybody. So if anybody would like information about how to get started with that, or if they want to not do the work of getting started with it, but want to include some seniors or some facilities, I included our volunteer at GP Care email in there. They can reach out to us, and it's as simple, now that we're up and running with it, it's as simple as adding them to the daily mail out. And the results from that have been, well, it's been amazing. Those 2 programs have really, really touched and reached so many people, and they're so simple. We have several other programs going on a regular basis, like we have a comfort care bag that goes out to anybody who's got a loved one that in the area that is actively dying. And what we do with that comfort care bag is we collect goodies from the community, basic toiletries, games, literature, and put it all in and 2 teddy bears. There's always 2 teddy bears in every bag. And the reason for that is 1 teddy bear is for the person who is actively dying, and the other teddy bear is for them to give to somebody that they love. So this has been also a really, really busy program. Thank you. I love this. This has been the best Zoom meeting in a really long time.
Thank you very, very much. That's so, I'm so pleased to hear your programs and how great they're doing, and that you're enjoying this. This is awesome.
Well, and that we're all getting together to share the programs. That's just fantastic.
Yeah, great. Thank you very much, Hope.
Thank you.
I think Fay is next.
Hello, sorry. Yeah, I'm from Whitecourt, Fay Arcand from Whitecourt. Been taking a lot of notes, so that's good, thank you. Just Whitecourt has got, we started a virtual coffee talks, like a seniors connections, but we're getting a slow response. We're also not using Zoom, we're using our go-to meeting platform, which I don't think as I'm listening may not be as friendly. Like they do have the phone in option, but we're getting there. It's been about a month, like 4 weeks. We offer it weekly, and we've had a couple of attempts. I tried to walk seniors through, but it's difficult. We are getting some, our community secretary is doing some screenshots and going to send them out through our senior circle email to kind of help people along, but we don't have that ability or don't have staff to go into homes and help set them up like that iPad program that I've been hearing about, which is amazing. And I'll be looking into that a little bit more too. Yeah, and we do have the tax program, and community volunteer tax program for Whitecourt is mostly drop off. Last year we started a drop-in clinic, which was very successful. And we have one volunteer that's a real keener, and it's all, for us, it's 100% based, even off season. I'll circulate an email to our standing volunteers to see if anyone's available to take an off season tax return. And we've been getting them done quite regularly. But yeah, drop off has been our standard go-to. This February we're opening up in February 22nd. I don't know, we may have to use the food bank. The food bank has some windows set up with no contact, so we might use that building that they've set up to take in, because we do get people, we do have a sign-in sheet when they're dropping off their stuff. We record it when they dropped off, and then we require ID and a sign off so that they're verifying that they picked up their forms. So yeah, so that's about that. We do have a volunteer driver program, which is for a partnership with our cancer support group here in Whitecourt, and that's for medical drives outside our community. It is on pause because it's a partnership not only with our cancer support group, but with our Alberta Health Services palliative care team. And so it's been on pause, and which we have had a few requests just recent, like 1 or 2, but yeah, unfortunately we haven't taken that up yet. Meals on Wheels, we do have in our community partnership, like most, it is with our lodge. We have a great volunteer coordinator. Meals go out twice a week. Meals are made from our Spruce View Lodge, which is our senior lodge here. We do offer Hello Neighbor, which is a telephone. We started that in April, I think, when COVID was really hard, and it's still continuing with some volunteers. Most of the volunteers' feedback have been like, oh, my neighbor's good, my senior, it's matching volunteers that have already been vetted with other agencies. So like Rotary clubs and other agencies that have great volunteer vetted people, because we weren't able to vet at that point with the RCMP checks. So yeah, but that's still ongoing with some. Most of the seniors are feeling okay with where they are. For our neck of the woods is what our feedback is. We do supply a seniors newsletter. It's of course print is not, you know, not all that popular these days, but it is available on our whitecourt.ca website, which, you know, for the demographic isn't that great, but we do have some printed we have one senior that will deliver to other people, and we would too if we were asked, but she has some key people that that she delivers to, and we send it out to our senior circle fan out committee, which the senior circle have about 240 members, many of which are email savvy, so that's good. Yeah, and then we've just started just our virtual programming, and I'm not sure how that's going to look, but managing grief is with Alberta Health Services. We did have chair yoga. Of course, that was on pause. And then when we were kind of leery of starting it back up, our instructor started it free still, because we were paying her, but she started it free at, which is awesome, great, lovely. But it is, of course, on pause again. But it was great that our chair yoga instructor took it upon herself to start again. And we were, of course, supporting that idea. But yeah, but it's paused, unfortunately, again. But I like the idea of what I was hearing about the community of Vegreville doing their seniors link and Zoom. That is amazing. And I'm going to be looking into that for information sessions, because our coffee talks, we're just trying to get people connected and visiting for an hour, just kind of visiting and maybe playing some trivia and leading that. But I love your idea, Vegreville. Thank you, Lisa. I'll look into that a little bit more. Yeah, and we have in our seniors newsletter, we've got, you know, we've got some elder abuse information, some family violence information, our community garden. Speaking of seniors without walls, we are tapping into their Aging with Pride support group. So we're kind of advertising, because we don't have LGBTQ2S+ in our community for support in that regard. We are supplying that support for our seniors living with pride and aging with pride. So we're supporting that. We haven't found too much feedback. I just started promoting that. So I think it's great. It's kind of like every other resource we try to provide, right? So we also are doing community webinars with CRA for how to slam the scam, and doing that virtually as well. And the Service Canada and anti-fraud stuff, we promote just kind of reading material on what not to do. And yeah, just we have our transportation program, our dial-a-bus program, which is senior focused. Our Snow Stars, of course, is still going. Yeah, community garden, managing grief with Alberta Health Services is going to be virtual with webinars. So I don't know, all these things are, it's difficult for our demographic here, but we're trying, and we're seeing, I'm looking forward to hearing some success stories on what you guys are doing. So that's it from Whitecourt.
Thank you very much, Fay. That was a really well-rounded description of everything that you guys do. It's awesome. Okay, so next we're going to hear from Jennifer. Jennifer, are you ready to present?
Sorry, yes. So we do a lot. We're from Nanton, Nanton Quality of Life Foundation. We run an FCSS program as well. We do a lot of the same things that everybody else is doing, just a couple of different things. We have a music and memory program, specifically for seniors and or those who have difficulties remembering their early stages of dementia or Alzheimer's. And right now we have several people in the lodge, the seniors lodge, using music and memory, but we're going to be expanding that to include more of our community members. It's been a very successful program in the lodge. And we do we've done a couple of different like food delivery, fun delivery programs that for our seniors. So the last one we did was an apple pie delivery, and so the seniors can either come and pick it up here. It was all boxed, ready to go from a local restaurant, or we would just hang it on their doorknob outside their house. And so the next one I think we're going to do is a soup and a biscuit drop off sort of thing for the seniors. We also do a hometown gazette, just to let everybody know about all the different programs that are in our town. And I did put on the chat, we also did an intergenerational pen pal program that went really, really well. And we'll probably start it up again when it's not so cold out. Because we recognize the seniors don't really like to go to the mail when it's so cold, and neither does anybody. Yes, I can share our email, and this is Lori. She's our community support worker, and so she's the one that actually runs the music and memory. So I'll put her email address in the chat too. Thanks, everyone.
So now Deanne Young. Yeah, okay, thank you very much. I think Deanne Young was next.
Hi, everyone. So we're just doing a few different things than everybody else is doing. We are doing an armchair travel that is actually for the whole community, but for our seniors at our extended care, we're just doing the package a little bit differently. And then for our seniors apartments, we're doing a package for them too. But the information I found through a website called goldencarers.com, and I'll put that in the chat. And they have a lot of different countries, but basically it's just a package of games, trivia, taco seasoning recipes, how to make a piñata. We put in some margarita glasses and some maracas, and so they can just feel like they're going on a holiday to Mexico. And for the extended care in that, we've just adapted it a little bit so that their recreation workers can plan a day in Mexico with them. And we're looking at doing Australia for our next one, and just kind of do that through the winter. We also are putting some resource pages in our income tax packages. So when people pick up their income tax from us, they're going to get a little newsletter resource package of, events that we're planning, or community information or contact information, just because it's a way to get information back to the individual when they pick up their income tax, or we mail, I guess we'll be mailing some of our income tax packages back to them as well, but just mailing that information back to them. We also did a little sign campaign. These are on colored paper, but they can put these in their windows saying, "I'm good." I could use a hand with something. That's on yellow paper. The first one's on green paper. And then on red paper, if somebody sees this in somebody's window, they know to give them a phone call or check in on them. So just a little simple way for people to reach out. And we also are working with a business out of Edmonton called Heart to Home Meals. It is a for-profit business, but it's a different way of doing Meals on Wheels. They deliver frozen meals to our community once a month. And so seniors can phone in, and I can help them do the order online, or a family member can do the order online for them. And when the meals are delivered to their home, they can pay by cash, check, or credit card if they don't want to do a credit card online. So it's just a way for them to get a meal delivery program that gives them more variety of meals, and they also can order meals that are dietary specific. So if they need gluten-free or low sodium or those sorts of things, we can do that for them as well. For Seniors Week last year, we did decorative sugar cookies in a package, and we had volunteers do door-to-door drop-off. We even had volunteers that delivered them out into the rural areas, and our seniors loved them. They were fun. They looked like ice cream cones and butterflies and flowers and something festive like that. We also did a vegetable growing program last year that it was a container growing one. So we purchased, they were like vegetable sacks. We had a local greenhouse that filled them with dirt, and then they ordered what vegetables they wanted. And our seniors that were more mobile, they actually went out to the greenhouses and picked them up. But we did have our lodges and our extended care that also grew tomatoes and that was something for their residents to do as well. So just a few different things. So stay warm, everyone.
Thank you very much for sharing, Deanne. That's awesome. I love the signs in the window. That is so fantastic. Well, a lot of the programs that you mentioned are armchair travel, awesome, and yeah, really great sharing. Thank you so much. Okay, I think the next person who is ready to share is Karen Bradbury.
Good morning, everyone. Well, I'm trying to get some greenery there. I need it to be summer. So a couple of things that we've been doing in Innisfil is we launched I don't know if you can see this, Real Talk with Men campaign, mental health campaign. Sorry, just give me 1 second. I'm going to turn off that background. It's not very good. There we go. So a Real Talk with Men mental health campaign. So we did calendars, and we have some of our older men as well on the golf course. And we have some of their stories. They actually share some of their stories around issues such as suicide, domestic violence, substance use. In addition to the calendar, we did coasters that we actually brought to our local restaurants. So this one says, speak up and reach out because duct tape can't fix everything. And it has emergency numbers. And on the other side is our cowboys with our littles. So we did the coasters as well, very well received by the community. We actually ended up having to order an extra 1,000 calendars. So we gave out 2,500 calendars. We had 10,000 coasters, and we also did posters and did a business campaign. So that was launched in November. We did a canvas display at one of the local, it's like a coffee cottage. If you know Innisfil, the coffee cottage is a wonderful little shop to visit. We did a canvas display there of some of the other outtakes of the photos. So this year we're looking at maybe looking at like a phase 2 of that. Now what do we do? So we were talking about an intergenerational men's mental health summit, something like that, whether online, might be online if we can't meet in person. And we've had some people contact us because of the campaign that said they want to be involved and they can be a speaker and that kind of thing. First, we are getting ready to launch the community volunteer income tax as well. Compass for caregivers, that training, some of our primary care network staff have taken that. So we have a lot of great partnerships in the community. We do a series called Innisfil Connects, and that's a 2-month calendar, very similar to Seniors Without Walls. So some of the activities that they do, they are via Zoom. So you can call in either on your telephone or you can sign in on your tablet and do it via video as well. So they do bingo, they do coffee time, digital drop-in, they have falls prevention group, that one's a closed group. They have movers and groovers, which was our group that met in person before COVID. 3 times a week for strength building exercise with our exercise specialists from the primary care network. So that was a fantastic partnership. We had anywhere from 70 to 100 seniors out 3 times a week for that. So because they can't meet in person right now, we've got about 20 or so that are meeting online through the Innisfil Connect. Last year we did, for Seniors Week, we did treats for the week. So we partnered with our local businesses, and I said to our local business, like each day, Monday to Friday, the seniors can go to a different business and get a treat for that day. So I partnered with our local business and said, okay, I will cover up to a maximum of whatever the amount of money is. And I said, like, so Mondays, it might be like a large fries from McDonald's. Tuesday, it might be Dairy Queen ice cream. Wednesday might be coffee from Tim's. You know, cinnamon bun from the Coffee Cottage or whatever. That went amazing. We had like 670 something seniors participate in that. So got them out of their homes, but they could go through the drive-through safely, and they felt, oh, it was still getting recognized, but it was really appreciated by them. We're looking at a similar thing for Seniors Week this year as well. We also have a Friendly Callers program. We're hoping to ramp that up a little bit now as the isolation continues. So that's a program where we do match a volunteer with a senior, and they touch base usually once a week, anywhere from 15 to 30 minutes. We did find out that some of the calls go much longer. They just kind of get chatting, and it's going awesome. So we do have that program going, and we did some winter kits as well in December that was distributed to the community. And most of this is in partnership with, you know, our local library. We have an association here called the Henday Association. They do adult learning, but they will actually take, they will work with some of our seniors one-on-one to set up their tablets, their laptops, teach them how to use Zoom and all of that. So anybody that needs that help, we direct them that way. So the Innisfil Connects is really getting some traction now, and we're finding some of our seniors are starting to buy their own tablets. Plus our library has some tablets that they can sign out as well for a couple of weeks just to give it a try. So those, it's keeping us busy. I was wondering when COVID hit, you know, how busy it was going to be. I think we've been busier than ever. So lots going on. So if anybody would like additional information, I'll put my email in the chat box, and you're free to connect with me for sure.
Okay, thank you very much, Karen. Great to see you. Yeah, so we don't really have anybody. I'm still hoping so some other people will say that they are ready to share. But in the meantime, maybe we can go back to a couple of things in the chat. So David, you were wondering about how the men's sheds are going. I think it's so important that we do talk about programs for men, and some of the things that Karen, you just had were great ideas. I know View FCSS partners with Alberta Council of Women's Shelters to put on Breakfast with the Guys, and that's a opportunity to create a space for men that can safely discuss a lot of different topics, but essentially to encourage them to be part of the solution to end domestic violence. We have not done the men's sheds though, and David, have you done them, and is there any specific questions that you want to ask? Maybe you can go next if you want.
Okay. Yes, I'm looking at a men's shed. I did bring it up at our museum board and thought it might be a good fit to put it in there. And we'll see how they respond to that idea. I'm making a pitch at their next board meeting. But I thought that was a mutually benefit group, because they need men who are going to tinker and repair old things and get them back running again. I do remember the story of what is this men's shed thing about at an FCSS AA. And it said, if you put 5 or 6 men around a broken lawnmower, they'll talk. They may not fix the lawnmower, but they'll talk. And I love that bit about duct tape doesn't fix everything. So getting men together and letting the talk happen as it may really appeals to me. I know when I brought it up, of course, it's immediately as soon as you bring it up, like everybody says, well, what about she sheds? What about she sheds? Well, maybe, sure. But the goal, the objective, if I put my FCSS hat on, what's the outcome we're looking for here is to find a way to address the problem that so many men do not share thoughts, feelings at beyond the fix the lawnmower level. So that's part of one of the things I've got on my agenda. We're looking at all kinds of different things in terms of what can be developed in our region. We did get a home support COVID grant from the federal government, and that's spurring us on to look at developing a home support program in Bonnyville. So we're in the middle of transitioning from a free COVID sponsored event program into a pay-as-you-go program. So we may be reaching out to a few of you who have experience with that as we develop our policies and protocols and collection systems, et cetera. So that's one of our current projects. I find it interesting that we may not be the only one, I'm sure others have as well, but we've managed to stay open most of the time and have allowed seniors to come in and visit with us, following all the Alberta healthcare protocols, masking, distance. We have got plexiglass screens up, etc. So there are ways it can be done, and that applies to all our programs, including the volunteer income tax. People are still coming in to see us. So we have been able to do that. We've had some brief periods where we were sort of under lockdown, but for the most part, 90% of the time, you have been able to come in and see us. So there are ways to make that happen, and we'd really encourage alternative methods, and it really slows us down because of the number limitations, but it is not impossible. So anyway, that was where I was going. If anybody has a man shed program going on and just wants to send me it, I'll just put my email in the box below. We should have left the "and" in our email. We're Bonnyville and District FCSS. If I'd left the "a" in, I could have just said send it to the bad FCSS, but we're just BD FCSS at town.bonnyville.ab.ca, and I'll put that in the box below. Yeah, I missed that "and."
All right. Thank you, David, for sharing. And it looks like there are a couple of resources in the chat box that you can contact, or they can contact you. And I think that's gonna keep you buoyant there. Okay, thank you very much. Now, I don't have anybody else on the list who's wanting to share. So would somebody like to just say, yeah, you're ready, or?
So this is Jennifer Sims from the Alzheimer's Society. If you like, I can take a kick at the cat. So I'm the regional lead, the Alzheimer's Society of Alberta and Northwest Territories. So we have offices in Yellowknife, Fort McMurray, Red Deer, Lethbridge, Medicine Hat, Edmonton. So this information is helpful for all of those areas. The Grand Prairie region goes from Grand Cache to high level. So just to give us a little bit of idea that way. So we have quite a few things going on, and COVID has kind of been a little bit of a silver lining to us because we've been able to get so many things online. So we're excited about that. So our First Link program, and this is it's typically a direct referral program, but anyone can self-refer. So the First Link program helps to be able to connect families with resources for all different types of dementia. It doesn't have to be strictly Alzheimer's disease, whether it's vascular dementia, Lewy bodies, Korsakoff's, any different type of dementia. We are here and happy to help. So with the First Link referral program that allows individuals like it, again, to be able to have these different supports. So one of the supports is our First Link connection. So that's a 2-hour information session that families get together. We talk about different progression and how the brain works, things like that, different tips and ideas on how to support the person that you're caring for. We have care partner support groups. They run afternoons and evenings. We also have support groups for people living with dementia. There's support groups for young onset as well. So anybody that's been diagnosed before the age of 65. We have something new to us that is online called Minds in Motion. So Minds in Motion is going to be running, it starts here in February, and we have one going on Thursdays from the 18th to into April, and then another one starting in April. So Minds in Motion is a way for people that are living with dementia to stay active and meet and socialize with other people as well. So there are two different parts to it. So we have a cognitive section of it, and then we have a physical section of it as well. So when you register for it, we need to be making sure that there's always a care partner available, and it's for people that are living with dementia that are in early to early middle stage. So we'll be doing different things like board games, word games, bingos, different cognitive games, things like that. And then there'll also be a trainer there as well to be doing the physical side of things. We have our newsletter that goes out quarterly. We have webinars that are happening now as well. So for our webinars, for the community webinars, the next one is actually on Wednesday, February 17th. And it is Dr. Pamela Roach is coming to join us on the Sant Cafe. So that is ASANT Cafe.ca, and you can register there to be a part of it. She's going to be talking about constructing biographies and how to help people do that, especially with COVID-19 and things like that. We have memory kits that are available through the Grand Prairie Public Library. So they have, it's a great way to be able to reminisce. It has DVDs in it, CDs in it, there's music sheets, all those kinds of things, as well as ways to connect with the society. And then we have research studies that are available. So if anybody's wanting to be taking part in as a caregiver or people that are living with dementia, there's lots of different research studies that are happening right now. We're offering outreach sessions to communities if they're looking for just a 20-minute how to become part of the First Link, how to be doing referrals, or we have a longer, about an hour and a half to a 2-hour session that goes through, again, our brain presentation and a little bit more of the education parts to it. And I guess last but not least, we have a new ambassador program that we're hoping to start connecting to people in Peace River and try to allow Peace River to kind of be a hub for us, so we can be trying to reach more rural and isolated areas. So if there's anybody in the Peace River area that thinks that they would like to hear more about that, they can contact me as well. So that's kind of us in a quick nutshell.
Thank you very much. That's great. And, you know, I don't know if you're looking for more hubs, but I mean, we can also be a part, like Greenview can also be a part of facilitating that, distributing into the community as well. We're very, very open-minded to that type of thing. So
that would be great. And, you know, if there's any ways that we can reach out and connect further, I'll make sure that my email and contact information is in the chat, and I'd be welcome to go through more in depth, things like that. We're really trying to reach out to as many rural and isolated communities as possible. I think that it's it makes it hard for people that aren't able to get as many resources and things like that, which I'm sure that everybody feels the same way. So whatever we can be doing, we actually just had a new stat come in that we are receiving referrals from over 400 communities right now. So we're really excited about that, and we're serving almost 8,000 families. So we know that there's still a lot of families that are not being supported or are going through this alone or not even knowing what dementia is. And so we're there to be able to help to connect the dots that way.
That's awesome. That sounds like
I have a,
partnership.
sorry, can I interrupt here? Jennifer, I wrote it in the chat box, but I'm wondering if we wanted to bring those memory kits into our library, how would that work? How would we kind of connect? We have Alzheimer's Society has been awesome for us in Whitecourt. We've had some information sessions, multiple information session that's been very well received information, as it's kind of a you know, it changes with people's needs, but the understanding part of it all is really great when we do offer the information sessions. But for the memory kits, I haven't heard of them, and I'd be interested in looking into having them available in our library. How would we do that?
Yeah, for sure. Well, thank you so much for asking, Faye. So we have connected with the Grand Prairie Library, and I can put their contact information in as well. Then we can help you get the kits going. So what it is that there is a place down, I believe it's in the States, and they put these books together for us, and then we put our information in a folder as well. So what will happen is the library shares them. The people that are signing them out, they get to keep the Alzheimer's information, and then they send back the rest of the kit. When the kit comes back to the library puts another one of our folders into it. So then it's ready to go out again. And there's everything from music on the 50s, 60s, like all different types. So if you want, feel free to reach out to me, and I can connect you with all the right people to be able to build those kits, because they've been fantastic. They have them. They started in Lethbridge and Southwestern residents with the Chinook Arch Regional Library, and then we brought them up here to Grand Prairie, and they've been doing really, really well here.
Awesome. Thank you.
Yeah, absolutely. Thank you.
Okay, Sherry, Dennis, you ready to tell us what's happening at Seniors Outreach?
Hi, everyone. I had trouble with my message box, obviously. Thanks for, thank you. And I'd like to say a thank you to Lisa and Michelle for putting this together. This is awesome. And it's nice to be able to connect the faces to some of the people that we've talked to in the past. So thank you very much for doing that. Seniors Outreach is in Grand Prairie, our office, but we help the whole area and region, just as Greenview does, Greenview MD. And we've talked to a lot of you and partner with you, and we love that resource that we can use throughout the area. So Seniors Outreach is getting ready right now to do the income tax program, like Michelle. Last year we did about 1,400, even with our doors shut, which is amazing. We did it the same way, kind of with a drop-off box, and so we're looking forward to doing that. We brought back $12 million into the area. That's because we did taxes. They got back the GST and the guaranteed income supplement, Alberta Seniors Benefit, etc. So we're very proud of that number. Those dollars are spent back into our community. So it's really great. So Seniors Outreach is a one-stop shop. We'll help a senior with any need that they might have. We really like to create that circle of care. We've built relationships with about 6,000 clients in the area. And so if any of you are working with a client, a lot of times we have got a relationship with them, so we can help you or help the client to have their needs met. A lot of the time we're helping seniors apply for benefits and grants and old age security, Canada pension, and we all know what a challenge that can be sometimes for people that don't have all their documents, etc. So We help them through that process. Pretty much any need a senior would have, we'll help them. And yeah, it's great. We also offer the Meals on Wheels program here just in Grand Prairie. I'm interested. I was happy to hear about the Heart to Home in Edmonton frozen meals, and I'm going to look into that. That might help our us be able to reach a few more people that aren't able to have meals. So anyway, nice to see you all. I just basically wanted to say hi to you all. I miss people. I miss my seniors face to face. So it's sure nice to see everybody, and continue on the good work, everybody. We're here for you if you need us. Thanks.
All right, thank you very much. And you've got a really cute dog.
Oh, and my cats are running around here too. Yeah, thank you.
Okay, well, I don't see anybody else on the chat box that would like to share. So you know what, that's okay. But we do have a question for Sherry.
Hi. Actually, I don't have a question for Sherry. I'm Sarah. I work for the Okotoks Public Library. So I just wanted to, I guess, the question regarding the dementia kits for libraries, you could just reach out to your local library if you're interested in partnering with them to share those. That's actually something we're looking at doing. We're looking at partnering with the town of Okotoks to offer dementia kits that we can loan out to our community members. And we're not doing a whole lot of programming for seniors right now, but we are offering an online guided meditation. Well, staff's not doing it. We have a facilitator every Sunday morning. It's a short 15-minute meditation, and we've had people from all over take part. We've even had somebody from New Zealand take part, and that can be registered online at okotokslibrary.ca. You just register and you can receive the link. It's a good way to, not just for older adults, but for everybody to get your week started. Our challenge is trying to serve seniors who are not tech savvy. They obviously find it hard to navigate our website or our online catalog. So that's our struggle, is getting the word out. We do have, actually my coworker, Michelle, is on this call. She visits a local care facility and does a book talk, and we bring books to the residents there. And she's also starting a really great story, older adult story time, which I think will be popular. So that's just sort of the things that we're dealing with. We also offer online curated picks, so you can actually fill out a form and our staff will pick out books, because that's, I think, our biggest challenge. A lot of seniors prefer to come into the library and browse our collection. Obviously they can't do that. So we're just trying to identify ways we can still try to meet their needs while our building is closed.
Great. Thank you very much, Sarah. Okay, so I don't see anybody else who has requested that they would like to share, but if, I know that there's a lot of people out there on joining this meeting. So if you want, we'll take another 10 seconds or so to see if anybody wants to share or ask a question. Share awesome resources or online training, or maybe even training needs. So, or, one of the things I was wondering if anybody's actually got a elder abuse staff person or outreach person and how that's working, or I was wondering if anybody has that. So, oh, Tanya. Okay, we'd love to hear you, Tanya.
Hi, everyone. I am an outreach worker from Inclusion Foothills High River. I just kind of want to let everybody know what we do. We're a community support and resource network for people with disabilities, families and guardians, and we help them access inclusive services. So we also give them the opportunity to access like one-to-one support and feeling all in different areas from, education, PDD, helping filling out H forms, unemployment. We also have a connections registry there, which have service providers in there for community supports. We also have someone in there who can help with senior care, and she offers client-focused companion care. She assists seniors with daily living activities, shopping, meal preparation, errands, medical appointments, and she'll take them to exercise programs. So this is just new for us, but I just wanted to make everyone aware that we do have that. So if you are interested, you would go through, you just call us and just go through our connections registry, and we can get people connected with that. And that's it for me.
Okay, thank you very much for sharing. Yes, okay, so it does look like some people have family violence workers. So that's good to see. And, at the beginning of this, just as a sort of a recap, with our youth coordinator session, there was a lot of people, and people did like it a lot, just like the group here, and they do want to continue to meet monthly. And I'm not sure what your guys' thoughts are. I know we've covered a lot of information, and we have opportunity for networking. So I think Melissa's going to put up a little doodle poll sort of thing to see if people are interested in another one. It's okay if you're not, right? It's okay if you're not, but if you want to, we can totally make that happen. And sometimes it gives, in a month's time, opportunity to review what we've learned, come up with some more questions, maybe want to dig into something a little bit further. So it looks like there's going to be, at least 35 to 40 people who might want to do this. So that is great. Quarterly would be great. Oh yeah, okay, awesome. So really, I really encourage you to take the time to write some notes, find out what you want to know more about, and then we can take a deeper dive. We can take a deeper dive next month, or quarterly would be fine. Quarterly would be fine, yeah. Because so far 41 people have said yes, and that's a big group there too. So another day other than Monday, yep, we can definitely choose another day. We'll just work with the association again to see what works for them, and then Melissa will go ahead and put out another invite for maybe April, maybe even April. Yeah. Okay. Well, I think that's it for me. So I'm going to hand it back to, thanks again, Michelle, for helping me with this, and I'll hand it back to the association, to Melissa.
Excellent. Thank you very much, Lisa and Michelle. That was amazing. And all those stories and sharing, it just totally warms my heart on this cold day. Like, I think if we could just take all the energy that FCSS harnesses, we'd have a new energy source in Alberta. No problem there. If you have any ideas of sessions like this that you'd want to host, Lisa and her team have hosted the one, like she said, for youth, and now the one for seniors, but we don't expect them to do all the work. So if another program would like to host maybe around families or community or adult programming, we're happy to support you in any way, because these sharing sessions are just amazing. They also give us some great ideas or kickoff points for the annual conference planning, which we're getting down to right away. So yeah, if you're interested, let us know, and we're happy to host sessions that are relevant to you. We will send out the link to the recording along with any materials that anyone wants to send out. So if you think of a resource you'd like to include in the email that we send out, please just email it to me at director@fcssaa.org, and we will get that out. And I think that is it. So have an amazing week. Stay warm, everyone. Stay safe. Take care. Bye.